I hope you had a great break. Please take your seats. We are going to be starting, this is a discrete message for session 10, with session 10. If you're a participant in session 10, please be standing by and take your seats. While you're doing that, I will let you know about later on this afternoon when we have a huge commitment ceremony at 4:30 this afternoon. And at the end of that ceremony, we are living dangerously. We are going to take a group photograph. None of that hierarchy of only particular people can be in the photograph. We are all going to be in the photograph. Now, I didn't do very well at mathematics, and I'm looking at this stage, and I'm looking at you, and I am thinking it's going to be a very fun photograph. So that's at the end of the commitments ceremony, which is at 4:30 to 6 p.m. You might shift it a little bit. Please take your seats. Session 10, contributors, panelists, keynote speakers, please sit in the front row so I know that you're here. I don't want to start without you. Please come on in. Take your seats. Excellent. Now, I don't know if you've heard, but the President of Colombia will be joining us, hopefully towards the end of session 10, but it's possible that we might have to do some nifty reorganizing of session 10 so the President can also be part of that session as well. So do be aware of that. So there might be a slight pause as we come out of session 10, go into the President's section, and then come back to session 10. It will be exciting, particularly for me. This is where I get my adrenaline from. I love this next session because it's not just about financing, it's also about economic solutions. And sometimes, I'm actually going to stop for a moment until you finish your conversation, and then I'll carry on with mine. Please be seated. Thank you, everybody. All right. This session is now officially starting. When you've wrapped up your conversation, do let me know, because I do not want the keynote to come on the stage and everyone is chatting. Very good. Financial solutions and economic opportunities. It's not just about finding the money, but also about thinking smarter and working smarter. Our keynote that kicks us off, that will provoke us, help us think about how do we do this together, is Jane Burston, the CEO of the Clean Air Fund, that advocates for changes in policy, in laws that help clean up air around the world. Jane, welcome to the stage.
Thank you, Femi, and good morning, everybody. As we all know, Jakarta in Indonesia suffers from very high air pollution and major congestion. Data from the Environment Ministry tells us that there are more than 4 million private cars, 17 million motorbikes, 850,000 trucks, and 350,000 buses on the roads. And this air pollution from transport and also other sectors leads to over 10,000 deaths every year and 5,000 hospitalizations. And despite the situation in many situations around the world, air quality is severely underfunded. We've all experienced this. This chart is from the annual State of Global Air Quality Funding report that the Clean Air Fund produces, and it represents the total international development funding over the 5 years from 2018 to 2022, which is the last year for which data was available. And the percentage of that which is spent on outdoor air quality projects, it's less than 1%. I mean, we all know how many deaths there are from outdoor air pollution. It's more than 4 million, which represents about 7% of all deaths. So 7% of global deaths annually, less than 1% of funding. Philanthropic funding for clean air is also incredibly low. For philanthropic funding, it's 0.1% of the total. And that's shocking, not just because of the scale of the issue, but because of the multiple benefits that investing in air quality brings for health, for climate, and for economic development. So in slightly better news, air quality is a co-benefit, as we know, in projects intended to do other things. And when we account for this, about 6% of international aid has got air quality benefits. However, we also know that international aid is shrinking. It's unclear exactly how it's going to work out at the moment, but projections are that for this year, about a third is being wiped off the total that we expected. The closure of USAID and the withdrawal of many US State Department-funded programs means that vast amounts of funding has disappeared overnight, and many EU countries are also reducing their aid budgets. So with aid dropping a third, we need as a minimum to keep air quality funding the same. And if we kept it the same, at the same level as we saw in 2022, we would then represent 9% of the total. But I think we can do better, right? Right? Yeah. Yeah, way better. Exactly. I agree. Even in this difficult climate, I think it's possible to scale up air quality funding and to scale it up significantly. Why do I think that? Because of the multiple benefits that it brings. And let me tell you how I think it will happen. I think there's many things that donors and governments in particular can do, but I've focused on 3 things each. So for donors, number 1, start to account for the air quality impact of all of your projects. This means reducing the harm that might be being done in projects that emit pollution, and also capturing the co-benefits of climate and health projects for air quality to its full extent. If we can do that, we'll improve the rationale for each project, and over time, it'll really build up a bank of evidence about which are the project types that have the biggest bang for our buck. Where can we reduce greenhouse gas emissions and pollution at the same time, for example? One great example of monitoring air quality impact is the World Bank. Air quality is one of their new client context indicators. There's 12 of them. And what that means is that staff across the bank now need to start thinking for every project about its impact on air quality. So for donors, number 1, account for the air quality impact of your projects. Number 2, add air quality measures into sectoral projects. Obviously, we know that having a comprehensive air quality management plan is the absolute ideal, but also sectoral project offices on transport, on waste, on energy, as they're thinking about their decarbonisation projects or infrastructure projects, can think, how exactly could I add air quality in here, often for no additional cost and sometimes for only minimal additional cost. To help with that, a toolkit has been developed by the Asian Development Bank, the World Bank, and the Inter-American Development Bank, supported by Clean Air Asia and Ricardo AEA, which will help project officers find the guidance and see exactly how they can fit air quality into their projects. And the third recommendation is to treat clean air as an economic asset and not a cost. We know that there are huge healthcare cost savings if we reduce pollution. We know that there are massive benefits to business as well from the increased productivity benefit due to fewer sick days. And specific places and sectors are also affected. Cleaner cities can get more foreign direct investment, and sectors like agriculture will see higher crop yields. Retail footfall is higher on clean air days. So we need to emphasize these economic benefits more, especially when we're making decisions. For governments, what can you do? You can make the investment case. When seeking funding, look to the health department, get this data, work out the economic benefits and the ROIs. We found, for example, that climate investments only very rarely consider the economic benefit of the parallel reduced air pollution. And when that's added in, a third more climate investments become positive ROI. The second thing for governments is to create a stable regulatory environment. Investors need certainty. So one major step is to define ambitious yet achievable national air quality standards based on the World Health Organization guidelines. And thirdly, redeploy fossil fuel subsidies. We know that there's a shortage of development aid and that all national budgets are squeezed. But governments are spending trillions on ineffective subsidies that are worsening climate change and air pollution at the same time. The World Bank Detox Development Report is a great source of information about this, and it says that subsidies for fossil fuels, for agriculture and fisheries exceeded 7 trillion. That's 8% of GDP. That money could be repurposed and invested in solutions rather than perpetuating the problems. There's also obviously a role for researchers of providing the evidence to underpin all of this, and civil society for creating and showcasing and amplifying the demand for these solutions and holding these authorities to account. Back in Jakarta, some of these ideas have been deployed and investments have already been made into public transport. And cities like Jakarta, who we work with on our Breathe Cities program with Bloomberg Philanthropies and C40, are making these changes. They're showing what can be done. Today we're launching a new report called Breathing Life into Cities. And what we've done is we've taken the World Health Organization's target for this conference, which is to halve pollution and the health impacts of pollution by 2040. And we've applied that to 60 cities around the world, showing that if they manage to reduce pollution, the health impacts by a half, then they could avoid 650,000 deaths and save up to 1 trillion in economic benefit annually. Money is tight, we know that. And that's why we need to invest in solutions that pay dividends in multiple ways for our economies, for our planet, and for our health. Clean air is that solution. And investing in clean air isn't only the right thing to do, it's also the smart thing to do. Thank you.
Finance solutions, economic opportunities. What will our panels have to share with you? Alejandra Acuna Navarro is the member states representatives, the Executive Secretary of CMISCA, which covers the Central American region and also the Dominican Republic. Please come on stage and take a seat. You're very welcome. Good to have you. Priya Shankar, good morning. Director of Climate and Environment Program for Bloomberg Philanthropies. Hello. That's Priya's team clapping. You get a raise, you get a raise. Leonard Ted, United Kingdom, Head of Climate, Environment and Health. Hello, Leonard. Please take a seat. Very good. Would you mind moving a little bit closer to me? Thank you. Wonderful. Great to see. There's a microphone on your seat. You found it already. I love that. Interpretation device should you need it. Alejandra, you seem ready. Are you ready for this conversation? Of course. I'm just wondering, Central America and the Caribbean region, as you're working together, there's something beautiful about cooperation, but it's really hard to do. What are your successes regarding air pollution, finding the money for healthier air in the region that you represent? What can you share with us?
Good morning, everyone. Being with you here is great. One important element that I would like to explain here, which is CMISCA. This is the Ministry Council from Central America and Dominican Republic. This Ministry Council is a body in the health system of engaging in Central America and the Caribbean that makes decision in political issues, which is binding, because all the engagement due to a protocol in Tegucigalpa, all decisions are binding decisions. And this is important to highlight because our work is done with other instances of the integration system, such as CCAD, which is the council that has to do with all the ministers of environment. We signed a memorandum of understanding between both the councils, and from this we did a joint work to perform with each country an analysis, a diagnosis of how air quality was. And from here we signed, and we did, with the support of the PAHO, and we deeply thank you, a roadmap in order to work this air quality issue. But this is not only this. This is going to go beyond the commitments of COMISCA due to political decisions. We need to enhance governance in health issues, and this governance implies to modulate financing in health and enhance that financing. Well, we signed an agreement with Universidad of York and University of York, and with this signature, we did macroeconomy study to evaluate how was that the health condition versus the disease events, the non-communicable diseases, in this case, hypertension, diabetes, etc. So in that study, it was determined that the highest investment in health, of course, better health quality of people with the chronic diseases and the best well-being for people. But of course, an important element of this assessment was that not necessarily if the GDP is improved in health versus the national implies to remove resources to other sectors. If they are well invested, they can perfectly improve the health care attention. And always talking about investment, under this guideline, we've been working together with the Council that has to do with all the treasury ministers so we can implement some concrete actions.
Implementing concrete actions, Leonard. One of the areas that seems to me really obvious but very difficult is leadership. If you want to affect change, if you want to find the money, it's got to be leadership, right?
Absolutely, and we recognise that, exactly that point. So in the UK Government Foreign, Commonwealth and Development Office, we really tried to work at the political level to try and secure some of this leadership. So one really pivotal moment on climate and health more broadly, but out of that a lot of attention on air quality, was the UK presidency of the climate COP in COP26 in Glasgow, the city where I live, where WHO and UK government went into ministries around the world really to try and secure the political commitment to signing up to Glasgow principles on climate and health. And we've really found that that has been a step increase in the debate and the attention, and also funding has flowed subsequent to that, at least it has for the FCDO. And again, building on political commitment. So we've worked at successive COPs on political agreement, on a financing commitment, on a resolution on climate and health at the World Health Assembly with the Dutch government's lead that we co-sponsored. And this is really to try to make sure that the base is there, and we've sought that. There's a long history of regional cooperation. It was great to be sort of part and understand some of those processes. And because we know that it's national and also subnational government, we'll hear about cities, I'm sure, in this session, is to make sure that the resources are then available through, for example, the air quality management exchange platform that we're happy to support, so that when the political moment is there, then the resources are in place to help support mayors to deliver.
What is top of your mind to give us as an illustration, an example of how that leadership and opportunity goes together so well?
So very prominent in our mind is some of the opportunities this year with the government of Brazil and COP30. Last week they organized, they're the full credit to the Brazilian government. They're ahead of the planning cycle. They've got a concept note on climate and health. There's good content within that. And also the resolution on air quality at the United Nations Environment Assembly. This is the manifestation of that. That called for all of us to work collectively in partnership. The network was launched this week, and we all have an opportunity, as Maria was saying, to be advocates of this going forward.
Priya, when I think about leadership, certainly in the climate arena and thinking about health and climate going together, Mike Bloomberg is looming large in my mind. But if we're thinking about cities in particular, he's a champion, right? What can you share with us that helps us understand how to do our work better? How does the financing and economic solutions, how do they all tie up into what Mike Bloomberg did and continues to do?
Thank you, Femi, for that. And absolutely, one of the examples that we always like to cite as an example of progress and something that really informs our work at Bloomberg Philanthropies is Mike Bloomberg's experience as mayor of New York City tackling air pollution. When he was mayor, he introduced a Plan YC, a plan for a greener and greater New York, and a key goal was to improve air quality in the city. Using innovative data and research methods, it was found that heating was causing air pollution, was a big cause and source of air pollution in the city. So using this research, the city introduced regulations to phase out dirtier heating fuels. But it wasn't just the regulations. The city launched the NYC Clean Heat Initiative, working with civil society partners and private sector, and that partnership is key. And using that initiative provided engagement to residents, technical assistance to those looking to make the switch, and developed innovative finance mechanisms. And through this, the city reduced air pollution, sulfur pollution by nearly 70%, particulate pollution by almost 20%, leading New York City to have its cleanest air in 50 years. And also during this time, improved the life expectancy of New Yorkers by 3 years.
And the work that you're doing in terms of investing in cities, because we are talking money here, what would you share with us that maybe can be scaled up, can be done by other organizations as well?
Absolutely. And so one of the initiatives that I'm most excited about where we're investing in cities is what Jane referenced, our work on the Breathe Cities initiative with the Clean Air Fund and C40 cities. And what we bring to this is really informed by that approach of what has driven progress in cities. So we're supporting work on research and data. We're supporting work on citizen and community and resident engagement. We're supporting work to develop and design policies. And then we believe that cities have a lot to learn from each other. So we're bringing it all together to share lessons. And just to kind of cite a few examples, through the Breathe Cities initiative, we've heard this talked about earlier, the importance of kind of data and sensors. We've supported over 1,000 sensors across 14 cities that we're working in. And for example, here in Latin America, there's a lot of gains to be made. Jane spoke about the Breathing Life into Cities report. And if you look at the analysis that did in Latin America, it finds that if the 9 Latin American cities analyzed were to meet the WHO roadmap goals, in 2040, there would be savings of $65 billion. And it would also lead to 287,000 productive life years gained.
Leonard, as you're listening to your co-panelists, what are you finding very useful for the work that you're going to go home to do?
I just find it very, very practical. The ideas and the tools and the examples at national and subnational level. I mean, as Jane covered, we are in a difficult place globally in terms of the headline development finance, but I am heartened that of climate finance, sort of writ large, the climate funds and specific investments in climate, there is more attention to health. And this is really testament to health professionals relaying the evidence and the information. It turns out that civil servants and journalists are some of the people who are least trusted, but the health professionals, nurses especially, also doctors, are the most trusted. So when it's health professionals that are relaying, this is my experience, this is what the evidence says, it's really clear. It's also the case that among health finance, the big health funds, they're paying more, I really see this, they're paying more attention to climate and out of climate, the air quality specifics.
Alejandra, what is either the most important thing that you've said already or will be about to say to our conference that will help them find financial solutions, economic opportunities, in a sentence?
Invertir en salud.
To invest in health is to invest on the right of air quality. And I believe that the evidence that currently exists needs to be taken to the ministries of finance so that they may invest more and better.
You can say that when they have the 3rd WHO Global Conference on Air Pollution and Health, they will remember what you said today. What will it be?
Well, Maria talked about people being an army. I would want to suggest that everyone here should be an ambassador, because in this room where we all know what we're talking about, but outside of this room, a lot of people don't. And to take that message of building clean air and how important that is really for people's lives. And I think that's then what will ultimately also drive the finance, because if it's what people want, it's what politicians want, that's what the government does. So be ambassadors for clean air.
Thank you, and Leonard.
Maybe a sense of optimism. There are some areas where things are getting better, but how can that happen more quickly? And then also looking to where globally more work is needed. That's one reason why we're very happy to support the Africa Clean Air Programme, because there are a number of cities it's getting worse, not better. The last thing is that it was clear from the European experience that it was a sequence of ministerial ministers of health meeting every 5 or 6 years over quite a long time period. So we should understand that it takes political commitment and it takes time, but with that, the numbers, and we heard this from China and also in the European context, of lives saved and months of life extended are really dramatic, so we can all take that from here.
Thank you so much, panel. Thank you for your insight and your wisdom. We appreciate you. Please take your seats back in the auditorium. Thank you very much. Thanks, Leonard. Thank you, Priya. Thank you. Alejandra, is that set? Did you walk on the stage with that? Or is it one from here? It's yours. Okay. That gap is the gap in interpretation. Thank you, Alejandra. Thank you so much. I want to spend a moment with Benoit Bosquet, Regional Director for Sustainable Development for Latin America and the Caribbean region from the World Bank. Bringing a laptop to the stage? Well, let's see how that's going to work. Hello. Good afternoon. World Bank's always very popular in some circles. Please put this here. Do you need any assistance? Are you happy? You need...
with life.
Okay.
Generally.
Life assistance I can't help you with, but the microphone I can turn on for you.
Very good.
Thank you so much. And the timer's just there.
Very good.
Thank you.
All right. Always scary to see one's face on a big screen. But good morning. Good morning. Still good morning. Buenos días a todos y todas.
Good morning, everyone.
The World Bank Group, I wish to thank WHO for the opportunity to present our new flagship report on accelerating access to clean air for a livable planet. That is the name of it. I think I need to activate the clicker. So there have been many studies that show the significant health and economic impacts associated with air pollution and the why we need to address air pollution and the benefits from reducing pollution. Now, our new global analysis builds on these studies and aims to answer how we can reduce air pollution through cost-effective approaches. I will go over the findings fairly quickly, but the report is now online. You will see the QR code at the end, and our team is here, and we're available to answer further questions. So 2.3 billion people, including 1.2 billion in South Asia alone, were exposed to particulate matter 2.5 levels above 35 micrograms per cubic meter. That is in 2020. Let's assume this is today's situation. And over 3.3 billion people were exposed to levels above 25 micrograms. This had implications for human mortality, ambient air pollution, which is the focus of our study. Ambient air pollution accounts for over 5.7 million deaths worldwide. And this has, of course, serious economic implications. Damages are estimated between 4.5 and 6.1 trillion US dollars annually, which is roughly equivalent to 5% of global gross domestic product, a massive amount. The bad news is that this is going to get worse. It's going to get much worse by 2040 unless resolute action is taken. The good news is that action can be taken. But let me first run you through the doomsday scenario that even if countries successfully implement all their policies over the next 15 years, we will still see a rise of 21% in the number of people exposed to particulate matter 2.5, above the 25 microgram per cubic meter level. And this is simply due to the combined effect of population growth and economic expansion. In other words, we need to decouple economic and population growth from the growth in ambient air pollution. And in fact, reducing the number of people exposed to concentrations above 25 micrograms by 2040 by half is both feasible and affordable. I told you there would be some good news in there. So let me detail a little bit what this is. The best way to do this, according to our analysis, is to implement an integrated approach which combines conventional air quality management measures with energy and climate policies aimed at achieving goals like energy independence and reducing greenhouse gas emissions. Compared to the current policy scenario, which I showed you earlier, in this scenario, mortality can be reduced from 6.2 million in 2040 to 4.1 million. This is a 35% reduction in deaths due to ambient air pollution. It's still a bad scenario, more than 4 million deaths, but it's a lot less bad, it's a lot better than the over 6 million. And the economic benefits, based on the value of averted mortality alone, are estimated to range between $1.9 and $2.5 trillion in 2040. So this is per year, which is equivalent to 0.8% to 2.1% of global GDP. The other good news is that overall, achieving the clean air targets in an integrated approach will also help reduce greenhouse gas emissions, for example, black carbon emissions by almost 2/3. What does this all mean for policymakers? Well, we think that action needs to be taken along three axes: strengthening institutions, leveraging information, and catalyzing investments. And of course, the specific priorities will differ depending on the country and the regional context, but pretty much each country, each region needs to take action along these three axes. The first action axis is to improve clean air access, is to improve air quality governance. Successful countries, the countries that have successfully reduced exposure, have actually made clean air a top priority, embedding it into their national policies and ensuring it is supported by senior government leaders. This lays the foundation for sustainable and effective air quality management. The second axis is to ensure access to solid, reliable information on air quality, and then urgently, based on that, address the data gaps to prioritize investments. Without sound monitoring and disclosure systems, identifying pollution sources becomes challenging, and designing cost-effective measures is difficult. But let me be clear, we do not have to wait for all the data to be in for action to be taken. We can, of course, start now. In which sectors to invest? In short, across all sectors, but again, in different combinations, in different regions. Look, for example, on the very left of this chart, at the significance of the residential sector in sub-Saharan Africa compared to, in the third bar from the left, the mobile sources in North Africa. So this chart shows you the different combinations of actions that need to be taken. And last but not least, and I'm running out of time, I have run out of time, we need to catalyze investments. The Clean Air Fund, as Jane just showed you, published its report on the very low levels of financing for air quality management. We estimate from our side at the World Bank that to have the population exposed to PM 2.5 levels above 25 micrograms by 2040, we need additional investments of $3.2 trillion globally. This is obviously a massive effort, no doubt. However, as a share of global GDP, the investment cost following this integrated approach actually falls from the current 0.9%, 0.95% in 2020 to just less than 0.5% by 2040. And remember, the economic benefit of averted mortality I mentioned earlier is 0.8% to 2.1% of global GDP, which is higher than the cost. In other words, investing in this integrated approach to air quality makes economic sense. And obviously, to finance all of this, we will need the public and the private sector to work together. We will need to blend finance to shorten the payback periods of clean technologies and allow for rapid market penetration. Private investments will be facilitated by appropriate regulations, financial incentives, and the repurposing of harmful fossil fuel and fertilizer subsidies into positive investments. And there are now even initiatives, as you've heard, to develop clean air markets, such as in Gujarat. So let me leave you with this QR code where you can access the report, and thank you very much for your attention.
Thank you so much. success stories. We're so quick to go to the challenges that we don't flaunt our success stories. They can be just as inspiring as knowing what the problems are. You're about to hear two back-to-back success stories. The first one comes from Anwar Jahangir, the Secretary of Environmental Protection and Climate Change Department in Punjab, Pakistan. Anwar, welcome. I can see you, he sat right back there so he could get extra applause as he comes to the stage, no? I'm going to skip the story from the Punjab because I don't see Anwar, but I do see the Deputy Mayor of London, Mete Coban. Please come join us. Thank you. Hello, mate.
Hello, how's it going? Morning, everyone. Can I firstly start by taking the opportunity to thank the World Health Organization for putting on this incredible summit at a time that could not be more important. But can we also just take a moment to just appreciate my fellow Londoner, Femi Oke, who has just brought so much energy. She is a South Londoner, though, so I won't bring that to Colombia. I want to tell you about London's story, why it matters, and how we're transforming the lives of millions of Londoners. To be clear, and just like Jada said in the poem, the issue of delivering clean air is an issue of social justice. Because the reality is, the people who have done the least to cause the air pollution and climate crisis are suffering the most from it. In 2019, air pollution contributed to the premature deaths of around 4,000 Londoners. And the worst affected by this are those who have little choice about where they live, little money to think about moving away from highly polluted areas, and also those who are least responsible for causing the pollution crisis in the first place. We knew that we couldn't just stand by. In fact, when the Mayor of London, Sadiq Khan, first got elected in 2016, experts told us that it would take an estimated 193 years to bring London's air within legal pollution limits. That simply was not good enough. And we had to act. And we did. London has taken bold action to really tackle toxic air pollution. We're now home to the world's largest clean air zone, the ultra-low emission zone. And since expanding citywide, 97% of vehicles seen on London's roads now meet clean air standards. Roadside nitrogen dioxide levels in inner London have reduced by 50% and 25% in outer London, bringing the benefits to everyone. And that is exactly what the green transition is about. It's about uplifting every community to make sure that no one is left behind. The analysis of the inner London ULEZ alone shows that by 2050, an estimated 300,000 Londoners will have avoided diseases linked to air pollution. That's 1.1 million fewer hospital admissions and a cost saving of £4.2 billion to the National Health Service. These aren't just abstract figures. These are real people, real life change, and real communities thriving. I'd like to draw your attention to the first slide behind me, which shows the impact of the Mayor of London's policies since he was first elected. But the truth is, this progress didn't just happen overnight. It required real political courage, partnerships, and a real focus on fairness. We've delivered a scrappage scheme helping support 54,000 Londoners in switching to cleaner vehicles. We've introduced school streets that are helping protect the lungs of our children. We've invested in 24-hour bus lanes, quadrupled our cycle lanes and worked in partnerships with London councils to tackle toxic pollution, but also to reclaim our streets for people. Our mission to tackle toxic air pollution is fundamentally about building better cities, cities that work for people, cities that thrive. When we invest in clean air, we're investing in economic growth, job creation, and public transport systems that work for everyone. London now has over 1,900 zero-emission buses with a plan to reach 100% by 2030. These are boosting green jobs and cutting carbon emissions in the process. This is the green transition done right, delivering for our health, our economy, and our future. But while London has shown what's possible, we can't just do this alone. We've got to work together. And we're very proud to be a founding member of Breathe Cities, an incredible coalition bringing together cities from Jakarta to Bogota to Warsaw to really drive the action that we need to see pollution be cut by 30% by 2030. Now, if you look at the second slide behind me, you'll see the drastic reduction in nitrogen dioxide levels in roads in 2016 since the mayor was elected. But if you notice, look at the stagnation before the mayor was elected. And that is why leadership matters. That's my final message to you today. Leadership matters. It takes leadership to deliver policies that might be challenging but are essential for people's health. It takes leadership to put your own political capital and your own political future and your own political career on the line for delivering for what's right for citizens. It takes leadership to deliver a greener future that benefits everyone and not just the few. But it also takes leadership to build cities where clean air is a right and dirty air should never be normalized. Let's work together, not just for the sake of our climate, but for health, the dignity, and for better communities. Thank you so much.
Our final conversation before the President of Colombia arrives includes Brian Pedersen, Executive Director of the Clean Air Asia Group, Shweta Narayan, Campaign Lead, Global Climate Health Alliance, and Maurizio Cabrera, Vice Minister for Policies and Environment Standardizations, Ministry of Environment for Colombia. Thank you. Welcome all. Please take a seat on the stage. There are three of us all together. Good afternoon. Nice to see you. There is a microphone. There's an interpretation device should you need one. Please take a seat. Ha! Let's start with you, Shweta, because we're talking about how we create a better world for ourselves. And often that involves resources, which focuses on Christian. Leave no man behind. Christian Peter. Hello, Christian. How are you? Microphone on your seat. Or coming to you. All right. Excellent. Very good. So we're often talking about low-income countries, middle-income countries that have some of the biggest pollution challenges. But where does the money come from in that instance? How do we square that circle, connect the dots, whatever metaphor we want to use? That's a challenge, right? But there's an answer.
Absolutely.
Right.
And just to context that answer, and I want to repeat what Ambassador Nils said in the morning, that air pollution is killing us, and the economic costs are massive. The health damages from air pollution alone is $8.1 trillion annually. That's 6% of global GDP. And this is from hospitalization, loss of productivity, premature deaths, and the disproportionate effect of that is on low and middle income countries. Now, when we think about unlocking finance for clean air, first we need to identify where are the investments that need to be made. You will have an answer when you know what the question is. And in healthcare, and especially in low and middle income countries, we need infrastructure to strengthen frontline health services, build resilient health systems, empower community, train health professionals, have surveillance systems, early warning systems, and research that is actionable. Now, these kind of targeted interventions ensure that every dollar that is invested pays more and pays for health, pays for equity, and pays for cleaner air. Now, with the low and middle income countries where the resources are scarce, you don't necessarily need new finance or new money, but you need a new way of thinking. And that's where it's important that health community and health sector collaborates with environmental department or research institutes that have air quality monitoring. So your health system is not investing in new infrastructure, but tapping into what's out there, leveraging that to protect people in a smarter, in an efficient way, and in a way that is equitable. My one point, and this is for the investors. Clean air pays for itself. Now, in the US, this is evidence that every dollar that has been invested in clean air measures under the Clean Air Act has delivered $30 in return in economic returns. So that's 30 to 1. The money is there. Femi, you will be surprised to know, Jane said this, the money is there. We're just not spending in the right places.
Right.
Governments are spending $7 trillion annually in fossil fuel subsidies. A fraction of that money is redirected for clean air policies, will save millions of lives, will protect public health, and will ensure a just future.
Maurizio, you're looking at me like you have something important to say. Please say it.
Para Colombia.
For Colombia, the impact that it was having on deaths, people, the toll, and the loss in the GDP, deaths was around 1.2% of loss of that GDP. It was too high. And one direct relationship between the particle matter and the people affected in urban areas, but with an additional factor, which is deforestation that the country has had and was like around 200,000 hectares. This deforestation and fires in the Amazon region was generating a profound impact around all the national territory. It was affecting health quality of people in the great cities, especially in Bogota. Whenever you start seeing that articulation of the different agenda, and it's undeniable, that articulation between climate change agenda, Paris Agreement, the common agreement in Montreal to have a healthy space, healthy biodiversity, resilient cities, healthy cities is undeniable. All the discussions that are given around the World Agreement for Plastics is undeniable, the relationship between those different agendas. And therefore, the national government stated in the NDC of Colombia to have some goals related to reduce the black carbon. This is an ambitious goal of 40% reduction for 2030. Aiming to improve the life quality for people in Colombia, developing a regulatory framework to articulate the different agendas. We have been able to achieve through this action plan of biodiversity of our NDC goals to articulate those actions that are already generating important emissions and reductions. We have a reduction of more than 100% of deforestation in the country. We are having a strategy, a comprehensive strategy for fire control that help us to reduce greenhouse gas emissions and the collateral effects that are given. This is the articulated vision and a resource reduction to optimize here in Colombia.
Appreciate that insight. Jan, when Shweta says, you'll be surprised to hear the money is there, I'm not surprised because you already told me that, right? I've had those conversations with you. It's not about necessarily where's the money coming from. It's, well, I don't want to finish your sentence. You finish the sentence. Go ahead. What is the secret ingredient that Clean Air Asia has found for funding?
I don't know if we found a secret ingredient. We certainly didn't find more money. I just want to stress that. More finance is needed. More investment is. What we have found, there's often a challenge in accessing finance and investment. So when we work with cities and trying to work them through their climate and clean air action plan, understanding what measures they need to take, how to prioritize the measures, that's actually fairly easy now. We know that way to do that. We know we can come to those solutions on how to reduce air pollution. But then to access the finance. There we are trying to help cities with something as basic as how do you actually develop a bankable proposal that is palatable to the Asian Development Bank. It sounds simple, but sort of when the rubber hits the road where you have to start actually implement control measures, you very often need the finance and you need the investment. And the people who have driven this on a city level, at least in large part of cities in Asia, do not necessarily have the capacity and the expertise to easily access this funding unless it sits within the city already. So you have to go externally, go to, for instance, the Japanese credit mechanism, you have to go to ADB, or you have to go to private equity. How do you actually develop a bankable proposal that can help you reduce air pollution and mitigate climate change? And part of developing that bankable proposal is then to go back, do your health impact assessment, do your cost-benefit analysis. Of course, we want to ensure that we got our emissions inventories right. We need to understand what the pollution is, but we also need to have those health impact assessments in place. We need to understand what are the economic benefits of actually putting control measures in place so that the cities can prioritize the measures. I was very pleased that the gentleman from World Bank pointed that out. Then it's about how do we then access the finance that is out there. And we know there is not enough finance. We want more finance. Currently, we need to help cities to access the finance that is there.
Christian, from the World Bank perspective, as you're listening to these ideas about economic solutions, finding finance for cleaner health, cleaner air, healthier air, and limiting climate change, what are the bank's priorities for doing that in terms of where do you put your money? What do you bring to the table?
I think to some extent it has been presented by Benoit. It is really making smart decisions based on the analytics that are necessary in order to be able to prioritize. So I think what we need to come to, and the secretary who was supposed to be here unfortunately had to take an earlier flight, so he wasn't here. But we had a meeting this morning, and it was very clear is that he said to us when we had this meeting, it's actually interesting for me to learn that you as a World Bank don't only provide the financing, but you help us actually to get the knowledge in order to make better informed decisions. And so in this respect, I do think that what we have started working on much more now is really sort of to address what I would call, or my previous director called, the financial illiteracy that we are facing. So we need to really sit at the table and speak with the same knowledge. We need to sort of, those who need the money and those who have the money need to, in many cases, they speak over each other's head. They don't really understand what is it what you need, and here is a solution that I can provide. We're talking about private sector. what is the private sector? Private sector is not one big company. There are so many different solutions that can be provided in small scale, through small scale companies, and innovation can actually happen if these companies sit at the table, bring the solutions that are necessary. And I do think that what we also, and you mentioned it, Bjarne, the bankable projects, that's what the private sector always comes back and sort of saying, we would love to invest here, but we don't have a bankable project. So then again, it's about what is a bankable project? What is needed in a bankable project? And what's the policy environment where we as an institution can work with governments and really bring everybody to the table. So that's, I think, where I would think it is important to bring this. And I do think also that we look at this, here's the money coming from the multilaterals or the donor community. Here's the money that comes from the private sector. But I think government can also do more, because there are so many things that domestic revenue mobilization can help provide, and it's there. You don't have to bring it in from somewhere else. You repurpose the subsidies. That was what Jane was mentioning, the detox development report. So I think there are different solutions, but it really requires, to me, to sit at the table, overcome this misunderstanding or the not understanding and talking the same language.
All right. When you said bankable projects, Shweta had 1,000 thoughts going through her head. Share just one of them.
Yeah, and I'm not an economist, so maybe I don't understand the language very well. But just from a very naive perspective, I think saving lives is the biggest bankable project. Ensuring that children have an opportunity for a thriving future. No parent spends time in anxiety thinking about what their child might be getting if they have asthma or any disorder is a bankable project. I think that's the biggest bankable project ever.
Christian.
Yeah, I know. But sort of, I think what I think is important is that we're looking at the size of the problem, and we're looking at the planning which happened at different levels and the implementation that really needs to happen at the local level. And that's where we connect, right? So that this is where the connection will happen, because this is where we bring the planning side, the financing down to the local level. And yesterday somebody said that the principle of subsidiarity is really this, what drives this, because those are the solutions that need to be brought to those who suffer the most. And that's where I think we can help, and where we can work with different partners. So this is the other thing which I think is like, it's not the World Bank alone. It is World Bank working with others, World Bank working with governments, but not only with national or subnational level governments, but with local governments.
Why are we speaking different languages? Why are people not coming to the World Bank or to the private sector with projects that they think, we have to do this? Why is that happening, Christian?
I think they do, because we have the IFC, the International Finance Corporation, is the private sector arm of the bank. And I think they are, at the same time, also still struggling to find these bankable projects. We, from the World Bank's part, talking to our colleagues in IFC, we say, here, we have this idea. And they come back and say, well, nice idea, but we don't have a client at this point. So I do think that we would need, I think, sort of this crowdsourcing of ideas. We would need to sort of be more innovative in finding solutions that are already exist, and they can be upscaled, rather than inventing the wheels.
You were the last person on stage, and you created such an interesting conversation, as did everybody. I want to continue this, but we're going to have to pause for a moment, actually pause, to get ready for the President of Colombia. So, Christian, Brian, Greta, Maurizio, Vice Minister, thank you so much. There's so much for us to unpack and talk about, but for now I'm going to say thank you. Thank you for joining us on stage. Thank you very much. I enjoyed your company. Excellent. Oh my goodness. If ever we needed a Q&A, thank you, Christian. Appreciate you. Now was the moment for the Q&A. We will do Q&A over lunch together. Thank you very much, panelists. Appreciate you. We are going to take a pause while we reset the stage so it is suitably presidential, but I still have the microphone so I can tell you about the commitment ceremony later on today, especially if you would like to make a commitment and you don't know how to do one. So the Secretariat office is by the Bahanas rooms around the corner from where the WHO booth is. That is one place where you can sign up. And now, if you get a pen out or your phone out, I will give you the actual email that you can email right now while you're waiting for the president to turn up, so that you can add your name to the list if you would like to make a commitment. So are you ready? APHconference@who.int. I'll do that one more time for you. APHconference@who.int. Has everybody got that? Do I need to do it a third time? Yes? No? Yes? Okay. Third, final time. This is how you request a space to make a commitment in the commitment ceremony, 4:30 approximately to 6 p.m. Email this email address. Lowercase APHconference@who.int. All right, we got it. I'm going to leave the stage. The next person you will hear will be the president's moderator. So I'm going to go backstage here and watch and enjoy that session. Please stay seated, and it will start as soon as we're able to. Thank you very much for your attention. Thank you.